Hey there, fellow Americans! Welcome to the wild and wacky world of U.S. healthcare. Let's talk healthcare, that wonderful system where you can break a leg and your bank account. It's a place where a simple visit can turn into a financial nightmare. It's a jungle out there, filled with confusing jargon, sky-high prices, and enough paperwork to make a rainforest weep. From copays to deductibles, premiums to out-of-pocket maximums, it's easy to get lost. But fear not, dear citizen, because we're going on a safari through the wild world of U.S. healthcare. Think of me as your trusty guide, here to help you navigate this dense and often bewildering terrain. First things first, let's address the elephant in the room. It's complicated, like really complicated. The kind of complicated that makes you question your life choices. Imagine trying to assemble IKEA furniture while riding a unicycle and juggling chainsaws. That's the level of complexity we're dealing with here. That's the U.S. healthcare system in a nutshell. It's a maze of policies, procedures, and paperwork that can leave even the most seasoned navigator feeling overwhelmed. But don't worry, you don't need a PhD in insurance policies to survive. With a little guidance and some insider tips, you can make sense of it all. In this whirlwind tour, we'll break down the basics, expose the absurdities, and arm you with the knowledge you need to navigate this beast of a system. We'll cover everything from choosing the right insurance plan to understanding your medical bills. We'll laugh, we'll cry, and hopefully we'll come out the other side with our wallets somewhat intact. Because at the end of the day, it's all about making sure you get the care you need without going broke. So buckle up, Buttercup, because it's going to be a bumpy ride. But with the right information and a bit of perseverance, you'll be able to navigate the twists and turns of the U.S. healthcare system like a pro. Let's start with the gatekeepers of the U.S. healthcare system, insurance companies. These entities hold the keys to the kingdom of medical care, determining who gets access and under what conditions. They are the unseen forces that can make or break your healthcare experience. These folks are like the bouncers at a fancy club, deciding who gets in and how much they have to pay. Imagine trying to get into an exclusive nightclub, but instead of a velvet rope, there's a mountain of paperwork and a team of people scrutinizing every detail of your life. Except instead of a velvet rope, they have a stack of policies thicker than a dictionary, and instead of a guest list, they have a team of actuaries crunching numbers to determine your worthiness. These actuaries are like the gatekeepers of your health, using complex algorithms and statistical models to decide if you're a good bet for the company. You see, in America, healthcare isn't a right, it's a privilege. This means that access to medical care is often contingent on your ability to pay, and the system is designed to prioritize profit over people. It's a harsh reality that many Americans face every day. And like any good privilege, it comes with a hefty price tag. Medical bills can be astronomical, leaving many people in financial ruin. The cost of healthcare in the U.S. is one of the highest in the world, and it's a burden that weighs heavily on countless families. That's where insurance comes in, acting as your financial bodyguard in the ring of medical misfortune. Insurance is supposed to be your safety net, catching you when you fall and helping you navigate the treacherous waters of medical expenses. But it's not always that simple. But here's the catch: insurance companies are businesses, and businesses like to make money. Their primary goal is to generate profit, and they do this by carefully managing risk and minimizing payouts. This often means denying claims, raising premiums, and finding ways to avoid covering expensive treatments. So, they're not exactly in the business of giving away free health care. Every policy, every clause, every fine print detail is designed to protect the company's bottom line. It's a delicate balancing act between providing coverage and maintaining profitability. They're more like the house in a casino, always looking to come out on top. The odds are stacked in their favor, and they have a myriad of strategies to ensure they win more often than they lose. It's a game of chance, but the house always has the upper hand. They do this through a complex system of premiums, deductibles, copays, and coinsurance, all designed to make your head spin faster than a roulette wheel. Understanding these terms and how they interact can be a daunting task, leaving many people feeling overwhelmed and confused. It's enough to make you wish you'd just stayed home and played doctor with a Band-Aid and a spoon. The simplicity of childhood games stands in stark contrast to the convoluted reality of adult healthcare. Sometimes it feels like navigating this system requires a degree in finance and a whole lot of patience. Now let's meet the folks in white coats, the doctors. These are the brave souls who went to school for a bazillion years to learn how to poke, prod, and hopefully not accidentally kill us. They're like the mechanics of the human body, except instead of fixing your car, they're trying to keep your spleen from exploding. But even doctors aren't immune to the wacky world of U.S. healthcare. They're often stuck between a rock and a hard place, trying to provide the best care for their patients while also dealing with the demands of insurance companies and hospital administrators. It's enough to make you want to prescribe them a stiff drink. And don't even get me started on the whole asking your doctor how much a procedure costs thing. It's like trying to get a straight answer out of a politician. Good luck with that. Speaking of places where money disappears faster than socks in a dryer, let's talk about hospitals. These are the behemoth institutions where the magic, and by magic I mean incredibly expensive medical procedures, happens. Hospitals are like the luxury hotels of healthcare, with their fancy machines, private rooms, and gourmet jello. But just like those hotels, they come with a price tag that'll make your eyes water faster than chopping onions. And the worst part? You never really know what the final bill is going to be. It's like playing pin the tail on the donkey with your bank account, blindfolded and spun around a few times for good measure. Section 5. The high cost of healing. Why is everything so expensive? Now, you might be wondering why the heck is American healthcare so darn expensive? It's a question that plagues many of us, especially when we see those astronomical bills. Well, my friend, that's a question that's stumped economists, politicians, and late-night talk show hosts for decades. Everyone has their theories, but no one seems to have a definitive answer. There's no one easy answer. But here are a few contributing factors. And trust me, it's a complex web of issues. Administrative costs. Our system is drowning in paperwork, and someone's got to pay for all those forms and phone calls. The administrative burden is enormous, with layers of bureaucracy that add to the overall cost. Drug prices. The pharmaceutical industry is basically the Wild West of pricing, with companies free to charge whatever they want for life-saving medications. This lack of regulation means that prices can skyrocket without warning. Lack of price transparency. Hospitals and doctors rarely disclose the cost of procedures up front, making it impossible to shop around for the best deal. This opacity leaves patients in the dark until the bill arrives. Defensive medicine. Doctors often order unnecessary tests and procedures to protect themselves from lawsuits, driving up costs. This practice, known as defensive medicine, is a significant factor in the overall expense. It's enough to make you want to move to Canada and live in an igloo. The idea of escaping to a place with more affordable healthcare can be very tempting. But the reality is, we need to address these issues head-on. From policy changes to increased transparency, there are steps we can take to make healthcare more affordable for everyone. It's a long road ahead, but with collective effort and determination, we can work towards a system that doesn't break the bank every time we need medical care. So, let's keep pushing for change and hope for a future where healthcare is accessible and affordable for all. Section 6. Deciphering the medical maze. Tips for understanding your bills. So how can you navigate this labyrinthine system without going bankrupt or losing your mind? Here are a few tips. Read your insurance policy. I know, it's about as exciting as watching paint dry. But trust me, it's important to understand what you're covered for and what your out-of-pocket costs will be. Ask for an itemized bill. Don't be afraid to ask your doctor or hospital for a detailed breakdown of your charges. You might be surprised by what you find. Negotiate your bills. Medical bills are not set in stone. You can often negotiate lower prices, especially if you're paying cash or have a financial hardship. Appeal denied claims. If your insurance company denies a claim, don't give up. You have the right to appeal their decision. Section 7. Fighting back. How to advocate for yourself and your wallet. Remember, you are not powerless in this system. Here are some ways you can fight back against high costs and confusing bills. Shop around for medical services. Just like you wouldn't buy a car without comparing prices, don't be afraid to shop around for the best deals on medical procedures. Ask for generic medications. Generic drugs are just as effective as brand-name medications, but cost a fraction of the price. Utilize free or low-cost clinics. There are many free or low-cost clinics that offer basic medical services. Stay informed. Knowledge is power. Stay up to date on healthcare news and legislation. Section 8. The Future of Healthcare. A Glimmer of Hope. The U.S. healthcare system is far from perfect, but there are glimmers of hope on the horizon. Telehealth is expanding, making it easier and more affordable to access care from home. Price transparency initiatives are gaining traction, forcing hospitals and doctors to be more upfront about their costs. There's growing public support for healthcare reform, with many Americans demanding a more equitable and affordable system. Change won't happen overnight, but by staying informed, advocating for ourselves, and demanding better from our elected officials, we can create a healthcare system that works for everyone. Section 9. Take control of your health destiny. Navigating the U.S. healthcare system can feel like trying to solve a Rubik's Cube blindfolded, frustrating, confusing, and sometimes downright painful. But it doesn't have to be this way. By understanding the basics, asking the right questions, and advocating for ourselves, we can take control of our healthcare destinies. Remember, knowledge is power, and in the wild world of U.S. healthcare, a little bit of knowledge can go a long way. So stay informed, stay engaged, and never be afraid to ask for a price check. Your health and your wallet will thank you for it.